what are the different options and what are the different things a woman should do as part of the screening?
So let's talk about the average risk woman. We're not talking about BRCA mutation carriers here. But after the age of 30, once a year, get a clinical breast exam done by your physician, gynecologist, breast surgeon, whoever is your clinician you trust and are comfortable doing a breast exam with. Once a year, they need to do a physical breast exam after the age of 30. And then once you're 40, at a baseline, get a good quality digital mammogram. In the US, almost all centers do offer what we call as full field digital mammography with tomosynthesis, which is like a 3D version of the mammogram. And it does have very high sensitivity, good quality imaging. In India, there are still a lot of centers which are using poor quality, old, poorly calibrated equipment to do mammography. They end up not doing the mammogram right, end up calling patients back for an ultrasound. The patients get very confused. I was asked to do a mammo. They called me back for an ultrasound. The quality of reporting, because we are not primarily a screening country, the volume of normal images that an average radiology center sees is very low. So the experience of reporting mammography that goes hand in hand affects the quality of diagnostic imaging we have as well. So the quality of breast imaging in general is very poor, but we do have some very high quality, good imaging centers coming up. There is a Breast Imaging Society of India. We have qualified specialists now that are specializing in breast imaging, and centers, at least there are 8 centers in Pune which have digital mammography with tomosynthesis. So there are women do have options, but they don't realize that it's really one mammography center is not the same as the other. So if if you are undergoing mammography, you need to do it at a good place in a reliable setup where there are good technicians, good equipment, good radiologists who are comfortable and have a good volume and expertise of reporting breast imaging. I would look for full field digital mammography because a lot of people, they're offering analog mammography using what we call CR systems to then digitize those images. It's kind of like uploading your grandmother's old film, like a picture, onto the computer and calling it a digital image. But it was never acquired digitally at that high resolution. And the same goes for digital mammography.